Hello everybody and welcome back to my channel. If you are new to this channel, welcome to all the new subscribers. It's nice to have you on board on this channel where we talk all things nursing, faith-based, lifestyle, you name it. So without further ado, let's get into it. Today, we are going to talk about how to ace your nursing interview. How to ace your nursing interview for the first time. So if you are a newly graduate from nursing school, well done. Or you're just moving from one job to the other and you just want a little refresher on how to do well in your nursing interview, well, stay tuned because today I'm going to go through 7 tips to help you, 7 very simple, straightforward tips to help you do well in your nursing interview. So, tip number 1. This tip is so cliche, but it has worked for me. It works for me every time. Tip number 1 is be yourself. Guess what? Any interviewer can see when you're being yourself or when you're faking it. So if you're just faking it and you're just in this formal mode, it's not gonna cut it. Just be yourself. Remember why you love nursing. Remember the passion that you have for your patients and for caring, and you'll be fine and you will breeze through it. So be yourself. The second point is have, I'd say, 5 different scenarios prepared. Why do I say that? You need to have 5 different scenarios that will be ready in your mind to answer any question. So you need a scenario where maybe you had to manage your time. So a scenario that you need to talk about time management to basically demonstrate to the interviewer that you are good at managing your time. You need to have a scenario that basically explains, like maybe they might say, talk about a time where you had to deal with an emergency. You need to be able to demonstrate that you dealt with it efficiently and effectively because they want to hire the best nurses for their organization. So you need to be able to show that through. And this is something that you can do way in advance, way before the interview, that can literally put you ahead of all your peers. Have an example of how you manage an emergency. So think of something, even if you're a student and and it's fine if you actually are talking about a student experience or an internship experience, because they can see that, listen, you haven't been a nurse, this is the first time you're actually looking for a job, so they will understand. But you need to have examples and you need to remember it. And the best tip I can say is for you to remember all these scenarios. It's not just to sit down one day or a few days before your interview and then start thinking about all the scenarios. The best thing is to start now, while you're still in your internship, while you're still a student nurse. Write about different experiences that you're going through in your placement where you had to deal with an emergency, what you did. And they're looking for what you did, not what the nurse did, not what your manager did, what you did, because they want to see how amazing are you. You need to literally show to them, I am this amazing because I managed my time like this. I managed an emergency like this, and this was the outcome and what you learned from it. So you need to be able to literally show that you can do all those things and it's you, not somebody else. You need to have a scenario about communication, like talk about a time where you actually, showed really good communication. It's really important. A very good example is the communication between patients, families, doctors. There's a lot of communication happening in hospital. You can't miss but get a really good scenario. And another thing is, like, you always doing reflections. So there's probably a lot of reflective pieces that you've done as a student nurse. Take them all with you and bring them and have like a little small copy where you write all of these scenarios. So communication, have one about team building, like teamwork, because as you know, nursing is teamwork. Like, it's very much incorporated. There's MDT meetings that take place. And then in the morning after handover, you work as a team. Maybe you're on this side and you're on the other side. How you coordinate what you're going to do in the day, all of those things. It's important that you prepare scenarios. for that. So the first point was be yourself. The second point is have scenarios ready to talk about, to demonstrate those important key areas in nursing, such as communication, time management. Leadership is another thing, talking about maybe an experience where you had to take the lead in something clinically. Obviously all your examples have to be clinical. So yeah, scenario based. The third point is be confident. It's so important that you're confident, because you need to remember, like, because you can be the best nurse and have the most amazing experience in your CV, but not be able to actually portray that because you get mumbled with your words. Maybe you just get overwhelmed because there can be like 3 or 4 interviewers there and you kind of get stuck with your words, and it can happen. But if you are confident and you are yourself, if you connect the first point and the third point together, you will be just fine, because you have to remember, you are a nurse. You are literally a nurse. You've qualified, you've done all your exams, you are ready to go in the nursing field, and you need to be confident. And they know that your level is not going to be at a level of someone who's 5 years experience, or in the case that they'll look at how many years experience, and that's the level that they'll be looking at. They won't be looking for like 10 years experience if you've only 1 year experience or none at all. So remember to be confident. Be confident in what you've learned, in who you are as a person, as a nurse, and what you have to offer and what you need to bring to the table. And they need to see that. So you really need to be confident, because if you're not, and you let the nerves get to you, unfortunately, you're not going to be able to portray how amazing you are and all these wonderful experiences that you've had and what you have to offer for the organization. So please just be confident. And I know it's easier said than done, but one way to increase your confidence is to attend multiple interviews. The more interviews you attend, the more confidence you will build, the more practice you get. I know colleagues who just go for interviews basically just to learn how to sit in an interview. And it's daunting, it can be daunting, but the more interviews you sit in, the more confident you can become, and the better you can be at your interviews and ace them. Now on to the fourth point. The fourth point is make sure that when you are in the interview, you are attentive to what the interviewer is saying. I know this is a simple point, but sometimes a question is asked and you answer it, but it's not exactly what the interviewer is looking for, because the interviewer has a list of things that they need to tick off, and they're just main points, like bullet points, and you need to be able to answer that, because you can have a beautiful story of how you did an amazing thing, but if you're not hitting the actual main points, the interviewer is going to kind of ask you another question in the direction that they want you to go into. So they're not giving you the answer, but they're guiding you into the direction that they want you to focus on. So be really attentive to that, because there's only so many times an interview can do that until they have to kind of stop, because otherwise then, you know, time is going. In that point also, when you're explaining your scenarios, make sure that it's time sensitive. So don't try and start making like long stories about one point. Just make it like to the point and concise. So that is the fourth point. The fifth point is know what sections they're looking for. So oftentimes the way you're graded in an interview is professional knowledge, communication, leadership and management, and sometimes is team skills, team building, or building relationships. And these are the main areas that you basically can look at and focus on and be able to have an answer for all of them. So if you think about those different points, professional knowledge, communication skills, management skills or leadership skills, and then team building, all of that, different organizations have different sections that they look out for, but it's the same thing. It's like the general thing in nursing. Like, it's our bread and butter to be able to have good professional knowledge. We need to be able to be good leaders, because we have to take charge sometimes. We need to be able to communicate effectively in an emergency. We need to be able to work together well as a team, and that needs to come through in the interview. And oftentimes you get really great interviewers who want you to succeed and will really, like I said, guide you into the direction that they want you to be in. So yeah, they are the 5 points that I wanted to share with you guys that can help you in your interviews, whether you just graduated nursing and you're going into your first interview, or whether you're just 1 year or 2 years in, or how many years you may be in, but switching from one hospital to the other. If you can follow those 5 points, they will really help you. Comment down below if this was helpful, if there is an interview that you're preparing, how it went, and if these points were helpful. If there's any other points that you guys have actually come across and feel like they're also helpful, please leave them in the comment section below. Thank you so much for watching this video. Until next time, stay safe, stay blessed. Bye.